very much for joining us for today's technical briefing. I'm outlining some of the updates to the public health measures across Ontario impacting Ontario's heritage, sport, tourism, and culture industries. We appreciate you taking the time to join us here today. My name is Derek Rowland. I'm the Deputy Chief of Staff and Director of Communications to the Honourable Lisa MacLeod, Ontario's Minister of Heritage, Sport, Tourism, and Culture Industries. I have the pleasure of being your moderator once again here today. We're also joined by representatives from within our ministry, as well as the Ministry of Health and the Chief Medical Officer of the Health's Office. Before we get started, for those of you who have not joined us here previously, reminder that we will be taking questions here at the end of the presentation through the QA function. So if you do have a question throughout the presentation, please continue to pop it in there. And in the time allotted, we'll try to get to as many of them as possible. If we are unable to get to your question, I would still encourage you to reach out to our office directly by emailing us at minister.macleod@ontario.ca for more information. And with that, to kick off today's presentation, I'll turn it over to the Minister for her opening remarks. Minister, over to you.
Thanks very much, Derek. Thanks everybody for joining us. I'd like to obviously thank our colleagues from Public Health. So Colleen Keel, who has been with us for time immemorial, it seems, for the past 2 years. I want to say thanks to her. I'd like to say thank you to Dr. Murdy and, of course, Chris Harold for joining my Deputy Minister, Sarah Harrison, and our ADMs, Curry and Kelly Gatton, as well as my colleagues from Health and in the Ministry of Heritage, Sport, Tourism, and Culture Industries. As we learned earlier this week, our public health indicators are moving in the right direction. And as a result, Dr. Kieran Moore advised Cabinet and the Premier accepted the recommendation that we would be able to move up the easing of restrictions in the economy, but in particular, and primarily in the majority of the heritage, sport, tourism, and culture industries. So effective tomorrow, February 17th, we will be able to further ease public health restrictions, increasing social gathering limits to 50 people indoors and 100 people outdoors, increasing organized public event limits to 50 people indoors with no limit outdoors, and removing capacities in a variety of different places like restaurants, bars, drink establishments, non-spectator areas of sports and recreational facilities, cinemas, meeting and event spaces, including convention centers and conference centers, casinos, bingo halls, and other gaming establishments. This has been great news as a result of the hard work of Ontarians. And in particular, I would like to say thank you to all of you who have, since effectively March the 12th, 2020, have seen the peaks and valleys of this COVID-19 public health pandemic. I've said it many times, we're not just dealing with a public health crisis, but an economic and social crisis as well. And it is my hope that as we move into tomorrow and then a couple of weeks later into March the 1st, where we can see an easing of all restrictions, that our sectors will be able to rebound and will be able to not only survive but thrive and welcome people from around the world back into our province again as a primary tourism destination for those who are interested in visiting the places that we love to live in. To all of those in the sports sector, I know it's been very incredibly difficult, particularly as you deal with younger children who have seen the last 2 years with a number of stops and starts. And as a hockey mom myself, I have to say, seeing my daughter out playing hockey on the weekend was a real great joy. Just being able to hang out with some of the parents over a cup of coffee was something, maybe we took for granted prior to COVID-19. For those of you in the culture sector that have been suffering, our live musicians, those of you with live performances, I know it's been a very tough go. My hope is that we'll now get to some semblance of normalcy so that what makes us proud as Canadians can once again reinforce the cultural fabric and our social identity in this province. And I want to say thank you to you for all the great work that you've done. To those who are more involved in heritage and civics, like our public libraries, our museums, you continue to play a vital role in each community across this province, no matter how large or small you may feel. The reality is you continue to remind us of who we are as Canadians. And I know sometimes the images from my community right here in Ottawa over the past couple of weeks may have you questioning that. But never forget, you got through COVID-19, the pandemic of a century, and you've done it together, and you've done it with us, and I want to say thank you. And finally, to those in our tourism and hospitality, to our restaurants, to our hotel owners, to all of those who are, working through tourism attractions. I know this has been particularly difficult for you because not only were you dealing with a number of public health restrictions, but you were also dealing with, for many, many months and 2 years almost, restricted border crossings. Hope is on the way. We really do want to make sure that you succeed. You are a vital component. And I just want to remind all of you, when I started this job in June of 2019, I found a gold mine, which was heritage sport, tourism, culture industries. I had the great privilege of learning everything about these sectors and understanding the valuable contribution you all make to that spectacular double bottom line. So we are going to get back to business. We are going to get back together. We are going to contribute to a social and cultural fabric in this province together. And we are going to restore that $75 billion in economic activity that is this powerhouse suite of sectors. So today we're going to be led through the public health restrictions and what the easing of these restrictions are by Colleen Keel. My team is here to answer any technical questions. We will be dealing solely with the public health crisis at hand. There will be several announcements in the weeks ahead with respect to financial supports for our sectors, new money that I'm excited about, but it will start in the next couple of weeks, and I'm looking forward to getting some frontline support to each and every one of you. So with that, Colleen, I'd like to bring you on, and we'll walk through this deck. And I know we have many people that want to be participating in the question and answer, so make sure you go into the QA box there, and we will do as best we can. And Colleen, over to you. And again, can't thank you enough, Colleen, for the tireless work that you have been putting in with your colleagues at Health throughout this pandemic. So thank you, and I'll turn it over to you.
Thanks, Minister. And yes, it's definitely been a team effort for sure. So good morning, everyone. Big crowd here today, so I know there's lots of questions. It is a hefty deck here. I'm probably not going to go through the entire line by line. And so if questions about your specific sector are not covered, certainly we can try to get to those in the Q&A. If we could go to the third slide, please. So just to reiterate what you heard earlier this week and what with Minister MacLeod just emphasized as well, we have adjusted the timelines and updated the approach for reopening. And so today we're focused on the measures for tomorrow that will go into effect tomorrow, 12:01 a.m. And that was previously aimed for February 21st. Looking ahead, we are looking at March 1st, and that will include lifting of a large majority of restrictions left, as well as the proof of vaccination requirements. So next slide, please. So for the February 17th measures, still requiring face coverings and masks in indoor settings and physical distancing unless there's other capacities that is allocated for your specific sector. And so that's kind of a general individual requirement that's been in place for a very long time. And so there are some exceptions, certainly, for people, members of the same household, or when necessary to be closer to complete transactions. Next slide, please. Again, in terms of any instructions that have been issued locally, just to check with your local health unit to see if there are any things in effect. Most have certainly been aligning with the province, and there might still be things that are in place though. So definitely check in with your local public health unit website. Screening, and I see lots of questions about screening. So for February 17th, active screening of patrons continues to be required, and we'll go through the settings where that is required. Active screening of workers is still required. And then there are a number of settings where it is passive screening as well. The anticipation, and I know there's lots of questions about when that will lift. Our anticipation is that we will move to passive screening for March 1st, and so can plan ahead for that. Okay, next slide, please. Proof of vaccination continuing to apply in the settings that it has been required in, as well as the ability for the opt-in settings as well. So that isn't changing. Capacity is indoor capacity limited to the number of persons who can maintain distancing, unless again there's a specific capacity limit that's been allocated for this sector. So we'll talk a little bit more about that. Lineups still continuing to have some distancing in lineups, both outdoors and indoors, and regular cleaning as necessary to maintain sanitary conditions. No changes there. Okay, next slide, please. Still requiring PPE for persons who are providing services, and when they need to come within 2 meters of a person not wearing a face covering. Safety plans continue to be required, and so for live entertainment, performers still required to have 2 meters distance from their audiences. And then for outdoor spaces, still requiring that 2 full sides are open to the outdoors and unobstructed. Okay, so next slide, please. So I'm just, I won't, as I said, go read every line here, but just in terms of the high level points for personal care. So open with capacity limited to the number that can maintain a distance of at least 2 meters. This is a setting that can opt into proof of vaccination. During that time, the physical distancing requirements would not apply. And when proof of vaccination is being, the business is opting into proof of vaccination, there is a requirement for signage to be posted about capacity. Okay, the next slide goes to social gatherings and organized public events. These are now permitted indoors at 50 people and 100 people outdoors for both social gatherings and organized public events. We did have a period of time where those were a bit different, but those are lining up now. There are some exceptions, certainly for gatherings in retirement homes and those that are held in businesses or places that are subject to other restrictions. Weddings, funerals, and religious services, rites, and ceremonies. So this is for the service and ceremony part, permitted, again, with indoor capacity limited to distancing. Also a setting that can elect into proof of vaccination, during which time physical distancing requirements are not required. Next slide, please. Bathhouses and sex clubs, they're open at 25% capacity, and meeting and event spaces, conference centers, convention centers are open with indoor capacity at 100%. These are settings that do require proof of vaccination indoors, and in outdoor areas that have a usual capacity of 20,000 people or more. Active screening is required in these settings, and the room separation requirements continue to be the same. Just a note there on the meeting and event spaces, so they must comply with requirements for restaurants, bars, or food or drink establishments, with dance facilities whenever food or drink is sold, or while dance facilities are provided and in operation. Next slide, please. Libraries open with a capacity limited to the number that can maintain distancing. And again, the continued exemptions for camps, for childcare, and for social services. For concert venues, theaters, and cinemas, cinemas are open with an indoor capacity of 100%. Concert venues and theaters are open with a capacity limited to 50%, or where there is seating capacity, 50% of the usual seating capacity. For concert venues and theaters, the capacity must be posted to the signage requirement. Proof of vaccination requirements continue to apply indoors, and similarly outdoors where there is a usual capacity of 20,000 or more people. Requirement to be seated while watching the concert performance or film. Active screening is in effect for these settings as well, and reservations continue to be required for cinemas, concert venues, and theaters. Next slide, please. For fairs, rural exhibitions, and festivals, open with the indoor capacity limited to the number of people who can maintain distancing. Any particular indoor attraction is also limited to the distancing capacity. And these are settings also that may elect into proof of vaccination requirements, and similarly during that time, physical distancing requirements do not apply. Okay. Next slide, please. Amusement parks are open with an indoor capacity limited to the number of members of the public that can maintain distancing, similar to the fairs and rural exhibitions for any indoor attractions within those facilities, and the same in terms of electing into proof of vaccination requirements. And next slide is water parks. Open with an indoor capacity at 100%, proof of vaccination requirements applying indoors and in any outdoor areas. Although it's starting to warm up a little bit. I don't know about outdoor water parks right now, but certainly if there are any that have a usual capacity of 20,000 or more people. Okay, and next slide, please. For businesses that provide in-person teaching and instruction, these are open with indoor capacity limited to the distancing requirements. Maximum capacity must be posted, and any indoor space must be operated to maintain distancing between participants or students, and active screening is required. For tour and guide services, open with any indoor portion of the tour limited to the number of members of the public that can distance. And may elect into proof of vaccination requirements, and similarly to all the other settings during that time, physical distancing requirements would not apply, and active screening for employees and performers is required. Okay, next slide, please. Boat tours. So boat tours can be open with the distancing requirement as well. Also similarly can do the proof of vaccination election into that program, and the distancing requirements would not apply. For commercial film and TV production, open with capacity for studio audiences at 100%, and proof of vaccination requirements applying indoors there as well. Masks must be worn unless performing or rehearsing in a film or television production. Continue to reference the film and television industry health and safety guidance as well. Okay, next slide. So museums and galleries, aquariums, zoos, science centers, landmarks, historic sites, botanical gardens, and similar attractions. Open with the general distancing requirement in terms of the capacity for people who can maintain that distancing, and any indoor rides or tour vehicles within those attractions, distancing applies as well. These are settings that may also elect into proof of vaccination, and in which time distancing would not be required. This is similar to the theaters and concerts and cinemas, and that reservations are required, and that maximum capacity must be posted when proof of vaccination is not in effect. Short-term rentals open, and any indoor sport or recreational fitness activities complying with the restrictions for those facilities, which we haven't quite got to yet, but I'm getting there. Okay, next slide, please. Restaurants, bars, food trucks, concession stands, and other food or drink establishments without dance facilities open at 100% indoor capacity. Proof of vaccination requirements continue to apply indoors, with the ongoing exception for takeout and delivery. Dancing not permitted. Active screening continues to be required. Exemptions apply for some of these establishments that may be located in a hospital or airport, or if the only people in the establishment are those who work for the establishment, and safety plans are continuing to be required. Okay, next slide, please. Nightclubs, resto clubs, and other food or drink establishments with dance facilities open indoors at 25% capacity and outdoors at 75%. Maximum capacity must be posted, so the signage requirement continues. Proof of vaccination requirements do apply. Masking, active screening, the provisions around outdoor areas, if covered by a roof, and safety plan requirements as well. Next slide, please. Strip clubs are open with an indoor capacity of 100%. Proof of vaccination applies. No patrons are not permitted to dance. Performers must maintain distancing. Active screening and safety plan requirements continue. And just as a cross-reference to the requirements for restaurants, bars, or food or drink establishments whenever food or drink is being sold or served. Okay, next slide, please. So sport and recreational fitness facilities open with indoor capacity at 100%, excluding the spectator areas of the facility. Indoor capacity for spectators is at 50% of the usual seating capacity, and the maximum capacity for spectator areas must be posted. Proof of vaccination continues to apply here and in outdoor areas where there's a usual capacity of 20,000 or more. Masking requirements and screening and safety plans for leagues or events that are operating in facilities, as well as the facility must have a safety plan as well. There are some exemptions, and those are similar to the exemptions that have existed previously. Next slide, please. So for personal physical fitness trainers, open with an indoor capacity at 100%. The active screening is required and safety plans are required there as well. Community centers and multi-purpose facilities are open with indoor capacity limited to the number that can distance 2 meters, with exemptions for day camps or overnight camps, childcare, social services, and any fitness, sport or recreational fitness activities complying with the restrictions for sport and recreational fitness. Camps for children can open and if operating consistent with the safety guidelines that are available online. Okay, and next slide, please. So horse racing tracks, car racing tracks, and other similar venues open with indoor capacity at 100%. Proof of vaccination continuing to apply indoors and outdoors if over 20,000, if the usual capacity is over 20,000. Active screening is required, reservations for indoor events or activities or seated events, masking and safety plan requirements. Okay, the next slide, please. So indoor recreational amenities, this includes places like bowling alleys, indoor mini golf, arcades, and I'm sure many other places open with indoor capacity limited to the number of patrons that can distance. Also a setting that can elect into proof of vaccination requirements and the distancing would not apply during the time. Maximum capacity must be posted and must comply with the restrictions for sport and recreational fitness facilities. Outdoor recreational amenities, so this includes ski hills, outdoor ice rinks, snowmobiling, cross-country skiing, dog sledding, ice skating, and snowshoe trails. Any clubhouses can be open with indoor capacity limited to the number of patrons that can distance. Indoor clubhouses are also a setting that can elect into proof of vaccination. Maximum capacity must be posted, and any indoor rented space must comply with restrictions for meeting or event spaces. Okay, promise I'm almost done. Next slide, please. Retail. So retail remains open with indoor capacity limited to the number of patrons that can distance, and maximum capacity must be posted. For any test driving of vehicles or boats or watercraft, active screening is required, and face coverings or masks. Specialty vape stores cannot permit an electronic cigarette to be used for purposes of sampling, and cannabis retail stores may open and provide products through in-person, curbside pickup, or delivery. Shopping malls can be open with capacity limited so that the number of members of the public in the mall at any one time doesn't exceed the total capacity determined by the sum of capacities of every business in the mall. Maximum capacity must be posted, and the no loitering provision continues as well. For photography studios and services are open with indoor capacity limited to the number of patrons that can distance. And they also elect into proof of vaccination, and the distancing would not apply. Capacity must be posted, and active screening is required indoors. Okay, next slide, please. Real estate open houses are open with indoor capacity limited to the number of people who can distance, and may elect into proof of vaccination requirements, in which time physical distancing and capacity limits would not apply. And signage is required there as well. Next slide, please. Campgrounds are open and any indoor sport or rec facility, fitness activities complying with the restrictions for those facilities. Hotels, motels, lodges, cabins, cottages, resorts, and shared rental accommodation, the same provisions as campgrounds. Next slide, please. Marinas and boating clubs. So open with indoor capacity facilities there, limited to the number of patrons that can distance. Electing into proof of vaccination is applicable there, in which case distancing would not apply. Signage is also required, and any sport or fitness activities must comply with those restrictions as well. Driving instruction is open. Active screening for students. Every student and instructor must wear a mask or face covering. And any instruction provided in an instructional space is a cross-reference to the conditions for in-person teaching and instruction. Okay, and the next slide. Casinos, bingo halls, and gaming establishments are open with an indoor capacity at 100%. Proof of vaccination is required indoors. Active screening and the provisions that are in place now continue as it relates to no loitering or congregating around tables. Table game employees being separated by plexiglass or a barrier from patrons. There are some restrictions for any events in venues in any of those establishments that would cross-reference to the applicable section. Okay, and I'm going to go to the next slide, please. That's the last of the settings and the sectors. So wanted to just end with a preview of what's intended for March 1st. So certainly intending to take the additional steps to ease public health measures if our indicators continue to improve as they have been doing so well. So lifting capacity limits in all the remaining indoor public settings, lifting proof of vaccination requirements for all settings. So will no longer be a legislative requirement to require proof of identification and of being fully vaccinated in order to enter certain settings. Businesses or other settings may choose to continue to require proof of vaccination. It will be on a voluntary basis. Masking requirements will remain in place at this time, and a specific timeline to lift that measure will be communicated at a later date, and some limited additional protective measures will remain in place. Just a couple of follow-up notes there. So local medical officers of health, as noted at the beginning, do continue to have the authority to apply measures in their jurisdictions to target specific risks in their communities, and that our phased approach will continue to be guided by ongoing assessment and monitoring of key indicators in the in public health and in the healthcare system, including declining outbreaks in higher risk settings, declining percent positivity, and ongoing improvement or stabilization in hospitalization and ICU occupancy. And I will finish up there. I think we've got a whole pile of questions.
Great. Thank you very much, Colleen, for walking through a very detailed presentation there. We greatly appreciate all the information. Before we get to the QA function, I will just remind that we also have ADM's Tyler Curry in our sport division, as well as ADM Catherine Kelly-Gatton in our tourism, heritage and culture division here to also support with asking some questions, as well as representatives from the Ministry of Health, Chris Harold, and Chief Medical Officer of the Health's Office, Dr. Michelle Murty, to address some of the questions here. Colleen, I'm going to ask you to come back on because I know you discussed this right off the top here, but as you rightly noted, this is one of the key questions coming up here. So I think we'll address it right off the top as it relates to active and passive screening, particularly once the measures come into effect tomorrow, February 17th, but also the intention post March 1st. I wonder if you could sort of span the spectrum for us.
Sure, and generally speaking, active screening continues to be required as of tomorrow for patrons in the settings where it's been in place, and certainly in workplaces. Our intention would be for March 1st for that to move to a passive screening, and certainly to continue to message that anyone with symptoms should be staying home. I don't know if Dr. Murty wants to add anything to that as well.
No, thanks, Colleen. I think you said
Great. Thank you very much. That addressed quite a few questions off the top here, so we can get into some of the other nitty-gritty details. This question is coming from the live music sector, relates to karaoke. So the question, if karaoke is permissible before, and maybe I'll throw that one initially to maybe Colleen, if you have it off the top, or ADM Kelly-Gatton.
I'm just checking with my team because my understanding, I might have this wrong.
Yeah, Colleen, it's Chris. Karaoke is permitted as of February 17th. It's sort of dancing that continued to remains restrictive. I think we would remind people that anyone sort of performing must be sort of kept 2 meters away from anyone else.
Oh.
Great, thank you very much. I do have some questions here around physical distancing. They're not specific to any particular setting, but perhaps, Colleen, could I ask just general guidance around physical distancing within workplaces?
Within workplaces or within businesses? Sorry.
Both workplaces and businesses. I have one here asking for staff, particularly if they are on break and if they're eating in the break room, but also as it relates to some businesses as well.
Okay, thank you. So is it those provisions as it relates to workplaces remain the same for February 17th? Certainly looking ahead to March 1st, the anticipation that we're certainly going to be consulting with our labor colleagues about relaxing those requirements, and then in terms of distancing requirements in businesses, yes, that continues to be the general provision in most places unless there's proof of vaccination either required or in effect.
Great, thank you very much. I'm going to shift to the hospitality sector as it relates to self-serve food stations, including buffets. So the question is, will self-serving buffets in restaurants be permitted after March 1st?
Buffets are permitted now, like as of January 31st, but I will get Chris to confirm that for me, but it's a permitted reason why people can leave their seat in a food or drink establishment at this point in time.
That's correct, Colleen.
Great, thank you very much. This is a little bit more of a nuanced question as it relates to both sport, but also meeting and event spaces. We have a sport representative who is delivering an event in a convention center and trying to understand, do they follow the capacity regulations for sport or for the convention center itself?
So they would follow the restrictions related to the activity, so the sport and recreational fitness activities.
Okay, thank you very much.
Or facilities, yeah.
Perfect. I also have a question here from a tour operator. So when tour operators charter a bus for their group trip, do both the tour and bus companies need to eliminate the capacity restrictions or just one of them?
You cut out a bit for me there, Derek. I think the question was whether both the operator and the organizer need to do elect into proof of vaccination. Is that right?
Correct, and if it adjusts their capacity restrictions accordingly.
I might have to just ask my team on that one, just in terms of the nuance of both. But my sense is it would adjust the capacity, like if either one of them did, and it affected the actual participation of that tour, that it would adjust their capacity limits.
Okay. Thank you very much. I have a question here from representatives in the library sector, just looking to understand, are libraries allowed to open at full capacity without proof of vaccination, or is it only with proof of vaccination?
Libraries are not one of the settings for elected into proof of vaccination, so the general distancing requirement continues to apply in libraries for now.
Okay, thank you very much. Concession stands and food services, particularly in sporting venues. So the question here is, will food service be permitted in spectator areas of sport and recreational facilities, including vending machines and concession sales?
So as of January 31st, the provisions, sorry, I'm just getting my dates all mixed up. I think that was January 31st. Concession, food and drink were permitted in those settings, including concession and vending machines.
Okay, perfect. And I did also see another question here about the requirements to seat. Wondering if you could just speak to that as well when eating and drinking.
Right, so that is no longer in effect.
Okay, thank you. And so that only applies to sporting venues, I believe. But I also have a similar question here as it relates to theaters and cinemas for food and drink in those settings. Wondering if you could speak to that.
Yeah, so the requirement to remain seated is not in effect as of February 17th.
Okay, thank you very much.
Or seated while eating or drinking. Sorry.
Okay. Thank you very much. Question here from the dance studio sector. Are dance studios included in the list of permitted activities beginning February 17th? And if so, is capacity still limited to the number that can physically distance?
Dance studios, and so I might call on my colleague from Tyler's here, but dance studios follow the restrictions similar to sport and recreational fitness facilities. So they will be at 100% with proof of vaccination required.
Thanks.
Tyler's nodding, so I think I got it right.
Okay, perfect. I was just going to ask if you had anything more to add, but I'll take that as a no. Okay, let me see what else we have here. Looking for, and maybe this is a question for Dr. Murty, actually. It's a question as it relates to those who may be immunocompromised. So the question is, what advice do you have for those who are immunocompromised and looking to attend a live event or an in-person situation?
Yeah, thanks. I think general advice hasn't really changed for individuals who may have other health conditions that may put themselves at additional risk. We still are recommending for those individuals to take precautions, making sure that they are wearing a well-fitted mask when they're leaving their home, entering settings having settings where they have proof of vaccination, making sure that they themselves are fully up to date on their vaccination schedule. And then I think after that becomes a personal choice as to where they're willing to dissociate with, and that when they have personal social settings, making sure that they're trying to be with other people who are vaccinated as well.
Great, thank you very much. Colleen, I'll throw this next question to you, but if you need to phone a friend, by all means. It has to do with the Verify Ontario app. So the question is, will the Verify Ontario app stay active after March 1st when the proof of vaccination requirement is no longer required?
So I don't know if, my colleagues from that area are not on the line, but the intention is for the Verify Ontario app to remain available. I just don't know the timeline on that.
Okay, thank you very much. I have another question here from the hospitality sector as it relates to capacity within restaurants, meetings and events locations. So the question is, will distancing still be required between tables in these settings?
I don't believe that's required as of right now, but I will check with Chris on the team for that.
Yeah, hi Colleen, that requirement was removed, so it's gone.
Yeah.
Okay, perfect. Thank you very much. Okay. I do have a question here from the camping sector, asking, looking forward to the spring and summer, which hopefully comes sooner for all of us here in Ontario. Will there be revised camp guidelines released, or is the current one still considered in effect?
So as of right now, and Dr. Murray is there as well, as of today, the one that's in effect it remains current, but it is certainly being reviewed and likely to be updated shortly.
Great, thank you very much. Okay, sorry, I'm just trying to find some new ones that haven't been addressed here to get through as many as we possibly can. I have a question here from the live performance sector as it relates to rehearsals. So are live theater, dance, opera performers required to maintain
I lost you there, Derek. Sorry, can you repeat that?
Sorry about that. The question is, are live theater, dance, and opera performers required to maintain social distancing during rehearsals?
I believe rehearsals are an exception to that requirement. I'm just going to verify that one as well.
I see ADM Kelly Gatness popped on.
That's my understanding as well.
Okay, thank you very much. Just going to seek, again, a little bit of further clarity around consuming food and beverage here, because this one is a little bit more nuanced. Again, in the live performance space, specifically theater companies, is it required that patrons be seated to consume food and beverage, i.e. if someone buys a drink at intermission, are they required to be seated to consume it, or can they consume it while standing in the lobby?
The requirement to remain seated will no longer be in effect.
Okay. Perfect. Thank you. Okay. I do have a question here again from the wedding sector as it relates to dancing. I'm just wondering if you can outline what the requirements are for those who are looking to dance at weddings.
Yeah, so the requirements for dancing do follow the establishments with dance facilities. So they remain at 25%.
Okay. All right. And for those asking, I see quite a few questions here looking for a copy of the slides. And as we did with the last briefing, we will endeavor through our office to distribute this accordingly so that everyone has it as reference material. Okay, another question here as it relates to contact tracing. Can you confirm that contact tracing and or the collection of personal information is no longer required?
That was removed in the last round of changes. Yeah, so that is no longer required.
Perfect. Okay, I think we have time here for maybe one or two more questions, and quite a few of them are repeating here. I do have a question here as relates to schools, but also specifically in the after-school program settings. So looking for clarity, are children required to physically distance while participating in an after-school program?
No. So the after-school programs that are childcare and governed by the Early Years and the CCEYA, Child Care and Early Years Act, would follow any guidance from the Ministry of Education as it relates to programming. I think there might be some cross section with the kinds of facilities that those are operating in, but generally it would be similar to what's happening for childcare in schools.
Okay, thank you very much. I think our last question here is from the meeting and events spaces, recognizing that mingling is permitted in these settings. The question is, though, are samples, particularly food samples, permitted to be served in these meeting and event spaces for a convention?
That is a great question. We've had that one before, and I think it was. I think it relates to the requirements around food and drink establishments applying when food sampling is offered, and since there's no requirement to remain seated while eating or drinking, I think that does permit that. We may need to follow up and confirm that though with colleagues here.
Okay, we can take that one away and try to seek clarity there. So thank you, everyone, for your questions. We are coming into the last couple of minutes here. Want to remind everyone, if we weren't able to get to your question here today, that you can continue to email us at minister.macleod@ontario.ca, and we'll try our best to get you the answers in an expedited manner, as well as a reminder that we will distribute this deck later on this afternoon so that everyone has it as reference material. I want to thank Colleen for being so diligent in answering all of our questions, as well as our other panelists here. And at this time, I'll invite Minister MacLeod to provide any closing remarks.
Yeah, thanks again, Colleen, Chris, and Dr. Murdy for joining, my deputy, our ADMs, and of course, our collective political teams. Thanks everybody for joining us. I think we had over 1,000 folks at one point. So there still is a desire. So the next time we, reduce the restrictions or on March the 1st, we'll try and make sure that we're out there and available as well. And as I said, there will be additional funding announcements coming in the next couple of weeks for the hardest hit sectors within the province. So stay tuned for that. Today was strictly health related, so that we can get through as many questions as we possibly could. But I think today is a tremendous step forward. I think tomorrow many of you will be back in business, and I'm really excited for you to be able to open your doors and bring more people in to make both memories and money. And I think that this suite of sectors really is, as I've always said, a powerhouse and the crown jewel in our government and our province's economy and cultural fabric. So look, if you have any further questions, make sure to email in at minister.macleod@ontario.ca. The team and I will endeavor to get back to you as soon as possible. As Derek mentioned, we will be getting this deck out to you so you can provide yourselves and your teams on the ground with a great deal more clarity, and we'll continue to work on your behalf. So please, everyone, stay safe. Look forward to tomorrow, and hope is on the way. There is light at the end of this tunnel, and as Derek said, hopefully sunnier days ahead and better weather as well. So please stay safe, stay kind to one another, and we'll talk soon. Thank you.
Thanks, everyone.